In this video, we'll be reviewing the Mental Health Supports for Children and Employees option for spending grant funds. The pandemic, or COVID-19, not only affected the financial health of your child care program. The many challenges and changes have also had an impact on the mental health of you, your staff, and children and families. Mental health includes emotional, psychological, and social well-being and is important at every stage of life. It affects how we think, feel, and act, and it helps determine how we handle stress, relate to others, and make choices. Good mental health is just as important as good physical health. Let's make sure you use portions of the money to help children and your staff have the supports they need to be healthy and content. Funds received for use in this category would be used to help pay for childhood mental health supports and mental health consultations and other types of mental health supports for staff. Childhood mental health consultation supports include infant-toddler mental health consultation, or ITMHC, and early childhood mental health consultation, or ECMHC. Infant and early childhood mental health consultation, or IECMHC, is a strategy that teams mental health professionals with people who work with young children and their families to improve their social, emotional, and behavioral health and development in the settings where children learn and grow. Infant-toddler mental health consultation, ITMHC, is offered throughout the state at various child care resource and referral agencies, or CCR&Rs. There's no cost for this service, and the length of the service differs by program need or request. The audience for this service can be an individual staff or leader, child care staff, family child care, group family child care, or center-based child care. This service is offered in virtual, hybrid, and in-person formats. Because there's no cost for these services, you don't need to keep any financial records, but you might want to keep information on what services were provided, when, and by whom, so you can share that information with your regulator, especially if it counts towards your required training hours. If you have questions about training requirements, we suggest you reach out to your regulator. These funds can also be used for mental health consultations and other types of mental health supports for staff. The well-being of caregivers is important because their mental health and well-being impacts training, recruitment, and retention, as well as the level of care provided to children. Mental health support for staff can happen in a variety of ways. Funding in this category can be used towards staff training and development, staff patterns and schedules, and program materials and supplies. Grant money can be used to partner staff with professionals to provide training and technical assistance on topics like classroom coaching, the pyramid model practice-based coaching, reflective supervision, team building, and resiliency and stress management. For more information on these types of training, you can contact your local CCR&R, or you can visit websites for the Early Childhood Education and Training Program, Early Care and Learning Council Infant and Toddler Resource Network, New York State Association for Infant Mental Health, New York State Early Care Advisory Council, and the Devereaux Center for Resilient Children, DCRC. Some training may be offered at no cost, but if you pay for any of the training, be sure to keep the following for your records: paper or electronic invoice or receipt of the training date, time, trainer, and cost, and a receipt showing the amount paid and method of payment. Many of these trainings will also meet regulatory requirements. Check with your regulator or oversight agency if you have questions about a particular training. Funds can be used to support staffing patterns and schedules, to hire additional floaters to cover breaks, staff to support busy times during program operation where extra support would benefit children, such as the beginnings and ends of the day, infant and toddler nap times, non-napping time for older children, and part-time staff to provide additional breaks, planning time, and paid time off for full-time staff. You can also use the funds to support family engagement. Some examples could include providing opportunities for families to have conferences with teachers, purchasing materials to strengthen home childcare connections like activity bags and books in English and in the child's home languages, hosting a positive solutions for family or pyramid training delivery, organizing other activities with families like game nights or show and share activities in the classrooms. Purchase program materials to help build the mental health of everyone in your program by creating or adding resources to a staff mental health library. This may include books, audiobooks, or recordings in the areas of wellness, nutrition, exercise, and relaxation. Developing a parent resource library that connects families to community resources, including those specific to managing stress and trauma. And adding materials and children's books to the environment to spark discussions on emotions and stress. Some of these materials may include sensory materials such as Play-Doh, sand and water bins, and paints, additional play materials in the block, dramatic play, and music areas, and outdoor equipment, and duplicates of favorite play materials. Be sure to keep receipts of all your purchases for your records. For more information, refer to the Personnel, Payroll, and Benefits video or consult your local CCR&R, enrollment agency, union representative, or WEDCO. You can find information on the CCR&R that can help you through a link in your application. Remember, you do not have to submit receipts or invoices to get your grant money, but you do have to document how you spend it. And you'll need to keep those written or electronic records for at least 5 years. Your program could be the subject of an audit on how you use the federal funds to assist your program. If that happens, you'll need to be able to show how you spent your grant money and that it was used to improve your program or help it recover from the COVID-19 public health emergency. When it comes to mental health resources, don't forget about your healthcare consultant. They provide educational programs and technical assistance to programs to develop and implement sound health plans and practices. There are approximately 35 child care resource and referral agencies across the state, and each one hires or contracts with at least one child care health consultant. The COVID-19 pandemic has been difficult and has had an impact on children and child care providers' mental health. This is a valuable opportunity to support the mental health needs of child care providers, children, and their families.